Chronic Repeat Services, or CRS for short, is dedicated to patient well-being and saving lives. CRS technology helps remind the patient to take their medication, and it also provides an overview of behavior in relationship to the medication as to when it is taken or when it is missed. Now, which helps the patient to manage their health. CRS delivers a personalized and immediate support directly to patients via the app, offering patient medication management with convenience, which ultimately helps the patient to take their medication regularly and to manage their chronic condition. CRS also coordinates script refills and renewals, and it instructs the pharmacy to have medication ready for the patient when they need it. CRS is a one-stop shop for you, the patient, to lead a safer and a healthier life. So good afternoon, and welcome again to today's session. I've got in studio with me Dr. AJ Makan. Of course, he's a specialist. Doctor, welcome. And could you please introduce yourself and just give a very short bio of yourself?
Yeah, hi. Thanks so much for inviting me. Ajay Makan, as you said, a psychiatrist in private practice. It's been over 10 years now. Also have done an MBA and was involved in corporate work, and that brings in my interest in burnout, stress, and mental and, in fact, physical wellness for that matter. And dealing with all the stresses, and with that comes with all the mental health illnesses we see that I've been treating for the last, over 10 years.
Sure.
Yeah, thanks.
It's a long time. Welcome, Doctor.
Yeah, sure.
If you don't mind, I'm going to call you Doc for this session. Good,
sure.
Great stuff.
Okay.
So, of course, today's session is sponsored by Chronic Repeat Services. And we will be discussing mental health. I know it's a broad topic, Doc, but we will be looking at a couple of prevalent mental health illnesses and how they can be managed.
Sure.
So Chronic Repeat Services is dedicated to patient well-being and also then, of course, in saving lives. The CRS technology helps remind patients to take their medications and also provides an overview of their daily behavior. In other words, in relationship to when medication is taken and when it is missed. And this, of course, helps the patient to manage his or her life a little bit better and their health at the end of the day. CRS delivers personalized and immediate support directly to the patient via just an app or an application. It's offering patient medication management with convenience, which ultimately helps patients to take their medication regularly and to manage their chronic condition. CRS also coordinates script refills and renewals and instruct the pharmacy to have medication ready for patients. And as you maybe said earlier, when the doctor goes on holiday and is not available, of course now we've got CRS to fill that function. And so CRS is a one-stop shop that's leading a patient to a healthier life. Doc, so let's start maybe with a couple of questions.
Sure.
In these stressful times, we hear a lot about mental health and wellness. How is mental illness classified medically?
Okay, so there's various ways it's classified, and generally we use, quite a few countries in the world use the American system, which is the DSM classification. It will be really complicated to go into the exact detail, but what you will find, I will say rather, what are the general areas that you will find in terms of mental health that we deal with, and this will be in terms of the mood disorders, and those will be commonly, which we know as depression, the anxiety disorders. Then you get, for example, bipolar mood disorder. You'll get the psychotic disorders. So schizophrenia, for example, is well known. The other very common ones will be psychosis caused by substances, definitely. You'll get the eating disorders.
Okay.
Yeah, and then we also will say the addictive disorders. So these are some of the general classifications of illnesses. Obviously, if you're concerned about what illness you have, that would be where you'd go to the doctor. They would assess the entire spectrum and see where you would fit in terms of the classification model using the DSM, which is the Diagnostic Statistical Manual.
I see. Yeah.
So those would be some of the ways to actually assess the patient.
Yeah.
And what happens is the doctor will look at the various signs and the symptoms that you will present with, see in what category that would fall, and then
Yes.
make an informed assessment, because that will determine the type of medication treatment that the patient will need going forward.
I see.
Now, what then in terms of management will be very important as well. We, as much as there's medical management where we use medication, there's also what we call the psychological management.
Okay.
Okay, and that's where you'll get the as commonly lay word man's perspective would be talk therapy, but more so called psychotherapy.
Okay.
Very much more important as well. More so as we're going along, we're finding that the emotional environment of the patient also needs to be treated, or another way of putting it, the social environment. So very important nowadays, we find that we have to involve family, friends, the support group.
I see.
So that would be what I've actually outlined is the biopsychosocial model, and some will also say the spiritual model, finding purpose, meaning, calling in your life. So all those things are very important. What we do find also that impacts is, let's say, stigma of mental health illness. Now, many patients don't want to seek help.
I've heard about that. Yes.
The reason is because of the fact that it impacts on how society views you. People are concerned about that, or how the workplace views you. So all these things do play a role. And one of the things to say in terms of dealing with the stigma attached to it is that with the appropriate treatment, with the appropriate intervention, the patient can definitely lead a normal, healthy life.
Okay, yes, that's good. Yeah. That's interesting. Doc, maybe if we can get down specifically to South Africa.
Yeah.
Can you give an example of some of the mental diseases that are most prevalent in South Africa?
So in South Africa, yes, no different to any other country in the world, we see the whole spectrum of mental health illnesses.
Yes.
But there was a survey done where they described 17 million people in South Africa experience depression, substance abuse, anxiety, bipolar mood disorder, schizophrenia. These are the more commonly seen mental health illnesses, and these are also obviously well known by the public as to the various mental health illnesses we encounter in the country. So generally we'll find that most patients present amongst these illnesses, but yes, there are other illnesses. With the outbreak of the COVID pandemic, we're seeing a rise in anxiety, depression, and various other illnesses, and sometimes, as you will get, illnesses as a result of medical issues. So that's a whole different area. But the ones I mentioned would be generally the more common mental health illnesses we see.
I suppose COVID brought a new dimension and a total new dimension to the whole spectrum of different type of mental illnesses. Yes.
So what probably COVID has done is acted as a catalyst in the sense of, when I say catalyst, as much as you may be slightly anxious, the fact that you're working at home, isolated, away from family, has obviously contributed to loneliness, isolation, and that creates anxiety and depression. So all these things are, we're seeing more so. If you can say this, we're seeing now post-COVID the explosion in the manner of speaking of mental health presentations by patients.
It's crazy. Doc, tell me, what would someone do if they feel that they need help?
So generally, if you need help, depending on the family circumstances, speak to a family member. Chat to them, and they will help you, assist you, hopefully, in receiving help. If you feel this is something that's difficult to broach with the family, and I'm now even referring to youngsters, we see them in the schooling environment or in the university environment. Nowadays we find schools have some form of assistance available, or they will refer you to the appropriate mental health authorities. Universities nowadays have some form of counseling available.
Sure.
If beyond that, go to your local GP, your general practitioner. They will be able to assist you or refer you on if necessary. If we're still uncomfortable with that or we can't access that, you can seek online.
Yeah.
And there's various facilities in the South African context. There's the organization called SADAG. They very well able to help you. There's other organizations, be it Lifeline and other organizations as well, that can assist you. There's your local health clinics, be they public or for that matter private. And if you're still stuck, you can definitely go to your casualty of your, be it government or private hospital, and they will refer you on to the appropriate authorities. So in this day and age, more so than before, we're finding there's various other ways you can access the mental health system.
I see.
Yes, as we get to the end of the year, doctors you will find getting a bit more busier, but there's some way or the other to access the system.
I see. And people are coming to the front now when they feel that they need help. Is that more often that they do so? I think in the past maybe not to such a great extent, as you said earlier, because of the stigma that's associated sometimes with it.
So with more mental health awareness, we're seeing people approach doctors or therapists more so and seek their help. So this is a great revelation, I'd say, be it because of social media or the fact that media in general has brought the awareness of mental health to the forefront.
Okay.
Yeah.
Thanks, Doc. If you don't mind, let's talk about depression.
Sure.
How is depression usually treated?
So again, the first, the doctor will, you need to see a doctor, and then the doctor will do the appropriate assessment. For speaking from a psychiatry perspective, we will look at the intensity of the depression. If it's something mild, we may hopefully, the patient will respond to psychotherapy, a bit of medication that they can take short term. However, if the psychiatrist feels that the patient needs to be on long-term treatment, then antidepressants will definitely be considered. The most commonly used antidepressants are what we call the SSRIs, which are the selective serotonin reuptake inhibitors, and these are the most widely used in the world. Then you get the other grouping, the SNRIs, the serotonin noradrenaline reuptake inhibitors, that also has a slightly different form of functioning and also is quite effective.
Yeah.
We get what we now more so seeing is what we call the atypical antidepressants, and these have what we may say have a multi-mode of action. They worked on very different receptors. A common one is called bupropion, which works on the dopamine and adrenaline receptors. The traditional antidepressants, one we don't use as much anymore, is the tricyclic antidepressants, for example, and because they have some side effects which are not good necessarily, and that's why SSRIs came to the fore. And the first one we may know of is Prozac. The original actual name is fluoxetine, and that was they've even made movies about Prozac.
Yeah, absolutely.
There's a couple of other categories called the MAOs, the monoamine oxidase inhibitors, and those involve a bit of dietary restriction and various other restrictions that we need to consider, because those drugs will interact with those. So you have to, when you take any drug for that matter, please speak to your doctor to look at what may be the side effect profile of these various meds, what you may not take with these various meds. So those are some of the antidepressants. But it doesn't just mean that the doctor will prescribe antidepressants. They may consider medication to help assist you with sleep, help with short-term sedation or reducing the anxiety. Also be wary with the anxiolytics, for example. We cannot necessarily take all of them for a long period of time. They do have potential to be habit forming. So your doctor will generally prescribe them for a short period of time then try and definitely endeavor to wean you off. Together with that, though, the psychotherapy is important, the emotional support-based social support is important, and various other challenges you may be facing in life with a appropriate counselor or health professional therapist. They can assist you with dealing with these challenges. So it's a integrated treatment program, not just involving the psychiatrist. Can be definitely a psychologist, can be a social worker, can be an occupational therapist, and the nurse as well. So we look at it as an integrated mental health team that will help you on your journey.
Yeah, thanks,
Yeah.
Doc. Yeah, tell me, is it important for people suffering from depression or other mood disorders then to take their medication regularly? And then why?
Definitely, because okay, we take antidepressants, so generally most psychiatric medication is taken daily. Yes, we are now seeing a trend where there's some medication, fortunately, where for example, antipsychotics in the injection format can be taken nowadays 2 weekly, 1 monthly. Then that's amazing. It's very
It's a
new
breakthrough.
therapy, and it's not like every patient has access to those meds, and at the moment they're quite expensive. But most medication have to be taken daily. What you
Okay.
will find is that if you don't take it daily and you take it every alternate day or when you feel like it, the levels of that particular drug may drop in your system.
Okay.
And beyond the antidepressants, various drugs like the particular mood stabilizers need to be maintained within a specific therapeutic range. If you
I
don't
see.
take these drugs, for example, antipsychotics can present with relapse. And patients sometimes, sadly, it may have some impact in terms of a side effect profile, and patients don't want to take or they want to experiment with lowering the dosage.
Oh, yes.
Can be dangerous because it can definitely lead to relapse because factors like stress, lack of sleep, taking energy drinks can predispose to a relapse with lower levels of medication in your system. So it's
Okay.
very important you take your medication daily.
Yes.
If you feel that you are comfortable, that you wish to wean off, it's very important still to discuss with your doctor,
Yes.
and they will consider your particular illness and how it will impact on you if you decrease. If the doctor says it's fine, then it's great. But please continue with your medication. And what we do find that it doesn't mean that if you relapse or if you stop your medication that we just have to put you back on the original dose.
Yes. Yes.
Sometimes we find you may not respond to the original medication at the
Okay.
original dose. We may have to go to a higher dose. Various times as well, we may need to add more antidepressants or antipsychotics.
Okay.
So that then results in you being on more and more medication as you go along to need a normal functioning life.
Wow.
Yeah. So those are various factors, and it's important. We all want our patients, and this is why it's also important to take your medication, to live and engage with people normally,
Yes.
socially
Yes.
and
Yes.
occupationally. Want you
Yes.
to work normally and integrate with societally normally. And the medication in this day and age allows you to a great extent to do so.
Okay, excellent, Doc.
Yeah.
Thanks. Thank you so much. So tell me, with a reminder device, such as the chronic repeat services, will this type of application help people with mental health illnesses remember to take their meds?
Definitely. I mean, as a doctor in practice, it's every day there's a couple of files lying on my desk, and
Yes.
it's literally to write repeat scripts.
Oh, yes.
And the most challenging is when you somehow get this phone call on a Friday evening from a pharmacist.
Yeah.
Fortunately, the few that are open saying there's a patient who's here who's ran out of meds, their scripts
Yeah,
are exhausted. Please, can I give them the meds? And then they also saying, please, can you fax this through on a Monday morning? And you're like, set Friday evening.
Yes,
And,
yes.
amongst the other things you got to remember. So, yes, and especially now that we're approaching the festive season,
Yes.
the challenge is where a script is exhausted, trying to get hold of their doctor who's probably maybe out of the country on holiday, and they're running around trying to get a script. So those are some of the challenges patients may face. So it's very important that a reminder program of some sort, be it to the patient, be it to the pharmacist, so it keeps the system going. There's also the high schedule medication where you're not allowed to give repeats. So even if it's a reminder of some sort, that will really help the patient and the pharmacist, and for that matter, the psychiatrist that's prescribing the meds. So yes, reminder system will be of absolute value, and the fact that it's computerized, I think, makes a huge difference as well.
Yes, Doc, and what is so interesting is this is an app. You can download it onto your phone, from your iPhone or Android, and it's there, it's available. And also the interesting thing, maybe if we can just, conclude, the interesting thing about this application is that it will remind you to take your medicine, and it will even tell you if you didn't take your medicine.
Oh, wow.
So that makes it quite interesting. So so if you forgot to take the medicine, it will give you a reminder. So I think it's an app that is really needed.
And in the mental health field, I think that's very important because compliance is a huge area of concern in mental health.
Yes.
And we find that, yes, patients, it's cumbersome maybe, we all understand, to pop a pill in your mouth daily for the rest of your life.
Mm.
However, the fact that it allows you to function normally is important.
Yes.
And it's great to see a patient who's functioning for years with a very severe mental illness, be it in society, contributing to society.
Mm.
And sadly, we find sometimes when they struggle, it's because of the fact that they've been non-compliant.
Yes.
So, be it because we forget or the fact that your script ran out, some form of reminder would be great to assist the patient on their journeys.
Now, I think the question is, how can patients be reminded to take their medication regularly? Well, there's a new app available. And this app is made specifically for South Africans, and it is called the Chronic Repeat Services, or for short, the CRS. Now, this app allows patients to easily order their chronic script every month. And it also ensures that the medication is prepared in advance and made ready for collection and or for delivery. It offers patients peace of mind, and it helps to ensure that they never run out of their medication.